The topic is primary biliary cholangitis. Before we call this as primary biliary cirrhosis. The most common cause of PBC is autoimmune disorder. In this, the anti-mitochondrial antibodies are present. Now we study what is the pathogenesis of PBC. These antibodies damage the portal tract and the biliary pathway. Usually these antibodies attack the cholangiocytes. What are the cholangiocytes? These are the cells which lines the bile duct. So now see, this is the liver and these are the bile ducts and these are the cholangiocytes. So these antibodies attacks these cells and results in cholestasis, which is seen in the obstructive jaundice. And if the disease progresses, this can lead to cirrhosis in the patient. And this cirrhosis can be micronodular and the macronodular. So how the patient presents? The patient presents as the patient having the fatigue. Patient will have fatigue and pruritus. Why? Why this occur? Because these antibodies attack the cholangiocytes and which is lead to necrosis. So the bile salt will not excrete from the body. So increase in bile salt in the body which lead to itching. The patient feel itch. So this symptom is present. And also there is increase in bilirubin, which is mostly conjugated type. And the patient can have the portal hypotension symptoms like splenomegaly, pedal edema, ascites, and also present xanthomas. Why xanthomas? Because there is necrosis in the liver which lead to like the fat metabolism is not occurring, so xanthomas occur, and the patient will pass fat in his stool. So there is deficiency of fat soluble vitamins A, D, E, K. So mostly vitamin D is lost. Deficiency of vitamin D can cause to osteopenia and bone pain. So how can we work up this patient? We can do the liver function test. In this we can find the bilirubin level is increased, mostly the conjugated type. And the enzymes like SGOT, SGPT are normal. And the serum alkaline phosphate, this is the most important enzyme which is increased in this, which is increased more 4 times. And we can do the antibody test like anti-mitochondrial antibodies present in PBC. Third, we can also do the liver biopsy. Now we come up to the treatment of this patient. For the treatment, we prescribe the patient is UDCA. What is UDCA? Like urso deoxycholic acid. What this drug can do the patient? This slows down the progression of the disease. And we can also do the symptomatic treatment. We can prescribe antihistamines, and in severe cases when there is more antibody present in the patient blood, we can do plasmapheresis, and we can also give this drug cholestyramine to the patient. And in very severe case, like if this disease PBC progress to the cirrhosis, we can also do the orthopathic liver transplant in this patient. Thank you guys.